Dr. Amy Tiersten is an oncologist at the Dubin Breast Center at Mount Sinai, New York City, and at the Mount Sinai Tisch Cancer Center. And she's also a professor in the Division of Hematology and Medical Oncology. And she's a leader in breast cancer research. But let me go back to the oncologist part, because Dr. Amy Tiersten is my oncologist. And I met her after I had my breast cancer surgery at the Dubin Breast Center. And for the last 3 years, she has been taking care of my post-cancer work at Mount Sinai, because once you go through the surgery and you have the radiation, then for 5 years, you're on medication to make sure the breast cancer doesn't recur. And that's where Dr. Tiersten comes in. And I just want to tell you what I love about the care at the Dubin Breast Center and with Dr. Amy Tiersten. When I come in, I feel safe. I feel comforted. I feel informed. And that is thanks to the care and welcome I get every time I step foot in your office. So first of all, thank you for all that. And I just want to start, Dr. Tiersten, with how you decided to become a breast cancer oncologist.
Well, first of all, Shelley, it's been my pleasure to take care of you, and I'm delighted that you're doing so well. And thank you for having me here. And in terms of, I feel that I've always wanted to be an oncologist. Actually, it's very strange. I pretty much went to medical school to become an oncologist. It wasn't an acquired interest. And I think part of what compelled me is twofold. One is that it's a really scientifically interesting disease in that it's different from being a cardiologist or a infectious disease expert, in that oncology, cancer affects all parts of the body. So you're not focusing on the lungs or the heart, you're focusing on the whole body. And from a molecular biology point of view, it is an incredibly fascinating and rapidly changing field, and the science is very interesting. But more importantly, I find it very emotionally compelling, because cancer is something that strikes out of the blue, and it strikes any one of us. And being able to help someone through that crisis is an incredibly rewarding part of my work. People always say that oncology must be depressing, and I say that it's really actually very uplifting. First of all, we cure most of our patients nowadays. And even in advanced cases where we're not treating patients with curative intent, people can live really good quality and quantity of life. And we can help them, and we can help their families. And we see people at their worst and the families rallying around them, and the inner strength that patients have. And all of that is incredibly inspiring and uplifting.
How did you end up working at Mount Sinai? And tell us what working at Mount Sinai means to you.
I have worked at several institutions around the city, and I made the switch to Mount Sinai in 2013. And I was very attracted. The Dubin Breast Center was fairly new at that time, and the oncology division was really growing. At the time that I came, there was only one clinical trial ongoing in breast cancer, and I saw this as an opportunity to build a program. So kind of coming into a developing program, a new center, was very attractive and exciting to me. I was, able to build a research portfolio so that we have the latest, a big menu of trials to offer patients for all stages and types of breast cancer, and really developing a research portfolio since I have come to Mount Sinai till now has been very, very rewarding. I love being at Mount Sinai as opposed to other institutions because we have great medicine of all types. So we have the best cardiologist if someone's having a heart side effect from chemotherapy, the best pulmonologist, and we all can really work together and offer expert care in all areas. In terms of oncology at Mount Sinai, we have an incredible multidisciplinary team. It's really a place where the breast surgeons, the medical oncologists, the radiation oncologists, the geneticists, the social workers, the psychologists, we really, really do function as a team, really doing all of our parts in taking the best care of individual patients as we can. And Dubin is a very patient-focused environment. And that's really one of the things that attracted me and continues to attract me to work there.
And actually, that attracts me as a patient because, it's very stressful, even if after the surgery and after the radiation. It's very stressful whenever you come in for an appointment. And I can't stress enough the level of kindness you get from the moment you check in, just giving your name, getting your temperature taken before I am ushered back into your waiting room. Everyone is just so kind, and you feel that kindness, you feel comforted by that kindness, you feel you are in a safe place. And the other thing I love about the care I get at Mount Sinai is the coordination. This is one thing that would drive me crazy if I had to keep on track, keep on top of every doctor I saw and everything they were doing for me. It would drive me crazy. It's all done for me. For example, every month I have to come in for my breast cancer shot that is preventing the recurrence of breast cancer. And when I come in for that shot, the first thing that's done after check-in is I'm given a sheet of paper and it has a list of all my next appointments for the rest of the year. Exactly when I'm supposed to come in, what time. I don't have to worry about that. I don't have to coordinate that. I'm never going to double book at Mount Sinai because every level of care is coordinated. And I have to actually thank you, Dr. Tiersten, because I had immense trouble with every single post breast cancer med you put me on. And remember, you have to stay on these meds for 5 years. And one was worse than the other. And I just thought we were out of options. And you found a new option that is not ordinarily used for my type of breast cancer, but you found that option. We tried it and it worked for me. And I have to thank you. And I just don't know where else I could have gotten that type of care. I was really terrified that we ran out of options and I was going to have to look at, well, what is the least awful treatment I can choose from? And all of these treatments are just pretty toxic. They're very strong because the idea is they're preventing the breast cancer from coming back. So we're talking about some serious side effects. So thank you, Dr. Tiersten, for finding a new way.
So it's really nice, Shelley, to hear about your positive experience at Dubin. I want to just speak to what you just talked about. And a lot of the medicines we use have a lot of side effects. In particular, in early stage breast cancer, about 2/3 of breast cancers are hormonally driven. They have the estrogen receptor. And the way we treat these cancers is with estrogen medications that cause estrogen deprivation largely. And those can have huge side effects, including hot flashes, joint pain, vaginal dryness, bone loss. And I view it as a key part of my job to, every time I see an individual patient, go through their side effects. Fortunately, over the last number of years, there have been a number of studies looking at ways to deal with side effects. So acupuncture has been shown to be helpful for hot flashes and joint pain. So first, we really try to support people with the medication. But at the end of the day, if someone's quality of life is going to be terrible, with all the supportive meds that you can give them, supportive acupuncture, all of the things we can do, I think you really have to be flexible and discuss with the patients trying another medication. Even in certain situations, if someone has relatively low risk disease, if a medication is slightly less effective, but way better tolerated, that's a reasonable choice to make. So I think that, the art here is really addressing the side effects and asking about the side effects. A woman might not realize that the vaginal dryness is from the medication. If you don't ask, they're not going to tell you. And, nationwide compliance with these medications is pretty poor. Patients just go off these medications because they can be really hard to tolerate. And it's really important to stay on the medication. So it's the job of the oncologist to ask about the side effects, address them, and adjust things properly.
Tell us about your research. What excitement is happening there?
There is so much exciting stuff happening in breast cancer these days, and it's all about the age of targeted therapy. So, years ago, it was just chemotherapy, coarse drugs that kill cancer cells, that kill normal cells. And there's still definitely an important role for chemotherapy, but where the revolution really has been initially in more advanced breast cancer, because clinical trials generally focus on the more advanced setting. And then as things look promising, move into earlier stage disease, understanding on a molecular level what makes these cells grow abnormally, and drug development at specifically targeting these pathways. And so by very definition, a targeted therapy that is working against a molecular abnormality in the tumor cell is going to spare normal tissue more. So the focus has really been on developing targeted therapies, immunotherapy, and now bringing some of these newer targeted therapies to earlier stage disease to further lower the risk of recurrence. So it's an incredibly exciting time. And I look forward to continuing to work in this field and move the field forward.
Tell us, Dr. Tiersten, about your most challenging day or your most challenging time at Mount Sinai.
As a breast oncologist, I think the hardest days are days when you're an early breast cancer patient that you've been following has a recurrence, and talking to them about that recurrence. That's one of the hardest things that we have to do. In the metastatic setting or advanced breast cancer, a given therapy will work for a period of time, and then we do repeated scans, and at some point the treatment stops working, and we need to talk to the patient about changing to a different therapy. Those are all challenging. I think it's really important to have a really honest conversation with the patient, to try to be as hopeful and optimistic as you can, but give realistic information as well. And then, unfortunately, in the treating of advanced disease, there does come a time where, the feeling is that further therapy is more likely to harm a patient than help them. And at that point, we talk about maybe not continuing active therapy and focusing on comfort care. And I think that it's really important to do all of that with a lot of empathy and really connecting with the patients and their family. And even those terrible days can be inspiring as well if you feel that you were able to help a patient and their family and help them digest and make decisions that are maybe in their best interests.
What is the importance from a patient's point of view of going to a teaching hospital?
Well, by very definition, a teaching or academic medical center in general, the oncologists specialize within a given area. So I do mostly breast cancer and some gynecological cancers, and there are oncologists at Mount Sinai that specialize in just lung cancer or GI cancers. And that's different. And that's different from private practices where the oncologists generally treat all the different diseases. Things are so rapidly changing that it's very hard to keep up with the literature, even if you're an expert in that field. I feel that it would be incredibly difficult to really stay up to date on all of the advances in all the different types of cancer In addition, at academic medical centers, there's generally greater access to novel therapies and clinical trials.
Okay, I'm going to kind of put you on the spot, Dr. Tiersten. What are we in terms of research almost on the verge of? What can we look forward to in terms of cancer breakthroughs? Because you're right there in research, you're boots on the ground.
I mean, we say that metastatic breast cancer is not curable. That's breast cancer that's spread to other parts of the bodies. And that is true. But that is a moving target because every year new drugs come out and patients are living longer and longer and living with therapies that are not interfering with their quality of life. So that word cure is, metastatic breast cancer is becoming more of a chronic disease that we need to treat. But patients can do really well for a long time. And the next greatest thing are more of these biological targeted therapies. I can't, underestimate how exciting it is to figure out what actually, the scientists that figure out what actually is making this cell go wacky and go where it's not supposed to go. And these drugs that target those mechanisms, and that's really the future, is more and more of that. And also, it's very common now, especially in advanced breast cancer, to do genomic profiling of the tumors. And that is looking for mutations that are specifically acquired within a person's cancer and offering therapies that are specifically targeted against those mutations. So that's a very exciting field. I want to not forget to mention one important thing. There have been major advances in the treatment of early stage hormone receptor positive breast cancer, in the sense that now we use genomic profiling. The oncotype test is one example of that, to pick out who are the patients who actually really benefit from chemotherapy and who are the patients that can just receive anti-estrogen medications. And we give chemotherapy to maybe a third of the patients who used to get chemotherapy. And it's so delightful to be able to spare all of these early stage breast cancer patients toxic therapies if they're not going to benefit.
Dr. Tiersten, you say early on you chose oncology, but when you were growing up, what did you want to be?
I always wanted to be a doctor. I had a brief stint there where I wanted to be a dancer, but I quickly learned that I wasn't talented enough. But I don't know. I think some personal experiences. My father had a heart attack and open heart surgery when he was 40. I think I was around 7. And he was actually one of the first bypass surgeries. And I remember feeling incredibly safe at the hospital, that nothing bad could happen in the hospital. It felt safe to me. My mother actually subsequently developed breast cancer, but actually, interestingly enough, I was already interested in oncology and even breast cancer before she developed breast cancer. So I've just always been attracted to science and helping people, and being a doctor is the best way to combine those two things.
Dr. Tiersten, tell us the importance of the annual checkup, getting your annual mammogram and sonogram, if that's recommended.
That's incredibly important, Shelley, because that's the way we pick up breast cancer at its earliest stage. And studies have shown that one of the reasons people are living longer and doing better with breast cancer, one of the major reasons is that we're picking it up so much earlier. Early detection makes all the difference in terms of prognosis and survival with breast cancer. And this is something that you can do to do your very best. If you are going to develop breast cancer, at least it's going to be found in its earliest possible stage. And that really is incredibly important.
Especially important since 1 in 8 women will get breast cancer over a lifetime. 1 in 8, that's a very big number.
Absolutely.
Okay, so get your annual mammogram. Please visit mountsinai.org/breast screenings today to set up your breast cancer screening. Again, that's mountsinai.org/breast breast screenings. And thank you so much, Dr. Amy Tiersten, for joining us today. But more than that, thank you so much for being my oncologist. You have been an absolute blessing. Thank you.
Thank you, Shelley.